50 attendees from government and industry participated in PSC's 2018 FedHealth Conference, PSC's premier event focused on the mission needs, technology, and acquisition challenges facing federal health agencies. Thomas Bowman, former Deputy Secretary of the Department of Veteran Affairs, kicked off the event as the morning keynote speaker, noting his observations on the current state of the department as a recently departed official. He said the needs of post-9/11 veterans are much different than the Vietnam generation, and the new generation's needs will drive where the VA is ultimately going and how it delivers care and customer service. The keynote address was followed by a fireside chat with Dr. Suzanne Randolph, Chief Science Officer at the Myotech Corporation, and NIH National Cancer Institute's Cancer Control Director, Dr. Robert Croyle, on how national needs drive federal policy and programs. Dr. Croyle noted that the private sector plays a large role in NCI, including offering services such as compiling population data, survey data, cancer statistics, and surveillance data. The next session featured a discussion on how CIOs are challenged to respond to emerging agency needs while optimizing resources. Agency information technology leaders discuss efforts and initiatives to achieve this balance, including enterprise standards, shared services, X as a service, data management, and security. Panelists included George Chambers, HHS Deputy Chief Information Officer, Bobby Saxon, CMS Chief Technology Officer for the Center for Consumer Information and Insurance Oversight, and moderator Melissa Chapman of Salient's CRGT. As a precursor to this fall's Vision Federal Market Forecast, members of PSC's Vision Forecast teams for HHS, VA, and the military health system discussed current market trends at these departments. Panelists included Joni Fernbaugh, BD Exec Consulting Services, LLC, Todd Pentezi, Perspecta, and Mike Vogel, K-Force Government Solutions, and moderator Bradley Saul, Vice President for Civilian Agencies at PSC. Following the panel discussion, the conference featured keynote remarks from Jose Arrieta, Associate Deputy Assistant Secretary for Acquisition at the U.S. Department of Health and Human Services. He discussed his initial efforts to introduce blockchain to the HHS acquisition process to revolutionize how HHS approaches acquisition. Arrieta ended by discussing IT modernization and category management. The final panel for the day discussed acquisition techniques and how federal health agencies can access private sector capabilities. Officials from the Defense Health Agency and the FDA discussed various initiatives at their agencies, including category management, small business usage, best-in-class contracts, and emerging technology. The group also touched on what to expect in the fourth quarter of FY18 and into FY19. Panelists included Leonard Grant of the FDA and Jackie Pinkston of DHA. Colonel Beverly Beavers of DHA also offered insights from the agency. Closing out the conference on a high note, Dr. Barclay Butler discussed the evolution of DHA, current initiatives, and the road ahead. He shared the transition plan of military health system and transition impacts. He touched on Secretary Mattis's priorities and how they align with DHA goals. Dr. Butler outlined the military health system strategic framework, increased readiness, better health, better care, and lower costs. Special thanks go to all the sponsors whose generous support made this year's FedHealth Conference possible. For more information on this and other events, to purchase the video library, or to join PSC, visit www.pscouncil.org.